All right, everyone, welcome today to today's Let's Talk Parkinson's. We've got Mary Kay Walker, Parkinson's New South Wales CEO, here today to chat to us about advocacy. Mary Kay Walker is going to talk to us about the Parliamentary Friends of Parkinson's and what is it, and give us a bit of an update about that. The National Parkinson's Alliance and the plan that they've just released. And how we work with other organisations, because that's a question that often comes up, is how we work with other organisations. So over to you, Mary Kay, whenever you're ready.
Thank you so much, Stacey, and hello, everyone. So nice to see so many happy, smiling faces. New South Wales Parliamentary Friends of Parkinson's. What is it and how did it come about? Well, it kind of came about almost organically, insofar as February and March last year, I was running around the halls of State Parliament House, making a nuisance of myself and having meetings with all sorts of pollies. And one of the early MPs that I befriended was Phil Donato, the member from Orange. I went out to Orange to a support group meeting, the meeting that Phil happened to be speaking at. So our paths kept crossing. And somewhere in like October last year, I saw Phil post on his socials a photo with him and the Parliamentary Friends of Safe Roads or something. So I reached out to him and I said, I didn't think state government had a Parliamentary Friends. I knew it was a federal government thing, and we're certainly party to the federal government Parliamentary Friends. And he said, yeah, you want to do one for Parkinson's? And I said, absolutely. So that was in October. He reached out to his, obviously, all the colleagues, his MP colleagues, and they had their first meeting, something like the 16th of November. Phil became a co-chair. Dr. Joe from Wagga was co-chair, and Robert Dwyer is vice chair. So he's from Port. So we have three rural and regional MPs, and we then organised a meeting, the team here at Parkinson's New South Wales and the three gentlemen, in something like the week leading up to Christmas, because they had to get paperwork done and all sorts of things sorted. So from an idea in October to them having their first meeting in November, and I think they got like 20 or 25 MPs join the Parliamentary Friends, which is fantastic. And so we had our first meeting week leading up into Christmas. And of course, they all go, we'd like to have a function and we'd like to have it as soon as we get back in the new year. And we're going, oh, really? Knowing that we're off for a couple of weeks and everything closes down basically in December and January. And here we are sitting the week leading into Christmas. Anyway, we then arranged to meet again like the first Monday back in January. And out of that, within 3 weeks, we launched the launch event, first Tuesday in February, which was the Parliamentary Friends launch event that was back earlier this year, which I think was very impactful. I'm not sure how many of you on this call were able to go to that event in Parliament House. It was really thrown together very, very quickly, and it was a great success. When we debriefed with the gentlemen afterwards, they said, oh, we'd like to do another event. And of course, we're all thinking, oh, that'd be great, September or October. And they go, no, we want it in May. And it's like, we've already got a really full schedule in March and April. So we managed to go, right, if it's going to be in May, it's got to be the first week, and we've got to make it the launch for Step Up. And again, it kind of all came together organically, although I think Terry sitting here on this call think there was a little bit, bit more work than just organic coming together in bringing together the event that we had in at Parliament House last week, which was very different to the one in February. But certainly we had the pollies, high level of energy in the room, and a lot of politicians to both events. You don't get the politicians there the whole time, but the fact that we had them popping in and out was brilliant. Now, both the state parliamentary friends and the federal parliamentary friends groups only exist for the term of the parliament. So even though this group's come together late last year, it only survives until the election next year. So the three gentlemen and ourselves made a very pragmatic decision early on to focus on three things. First and foremost, advocating for money for nurses. Second thing, and near and dear to our heart, Parkinson's New South Wales team, is some money for us beyond the $33,000 that the state government gives us every year. We'd like a little bit more, take the reliance off donations and fundraising. And the third thing, and this links in with the National Parkinson's Alliance, is you have to make a disease a notifiable disease at the state level first, and have to have every state and territory before you can go federal and make it a notifiable disease. So we're on the bandwagon of making Parkinson's a notifiable disease. A bit of a long shot because it's not an infectious disease, but it's our way of trying to get Parkinson's taken seriously and have some kind of register for it. So they're our three prongs. And I know that there was an email sent to me, a question prior, asking, are the Parliamentary Friends of Parkinson's considering changes to New South Wales voluntary assisted dying legislation? Unfortunately, we're not focused on that this Parliament schedule, but once the election is done and dusted next year, and wherever it lands, whether the Labor government stays in or it's a change of government, there will be a new Parliamentary Friends. There could even be new chairs and co-chairs, and we can sit down with the MPs then and figure out what our platform will be. So no voluntary assisted dying advocacy this time around. It's first and foremost money for nurses, money for us, and the third is make Parkinson's a notifiable disease. So that's a little bit of the Parliamentary Friends state level, how it came about by chance. I didn't think there was such a thing. I know that Rose Jackson talks about how she and Leslie Williams were running the Parliamentary Friends in the last Parliament. I didn't realise it was official like that, but we will certainly be on the agenda that whomever's in government after March next year will be creating another Parliamentary Friends, because there's just so much work to be done. Yeah, well, it's a health thing. So we don't know now that there is no place to register if someone gets Parkinson's. There's no capturing of that data. So if we make it a notifiable disease, then by legislation, people that are diagnosed with it have to be on some register somewhere. So like I said, it's a long shot, but the starting point is to make it notifiable at the state level. This is the complicated thing. We've got this two-tiered health system in the country where the states look after certain things and federally has, GPs and things over the top. So together they somehow try and work. So, yeah, we've got to get it at the state level, first of all. There is a whole palaver that you've got to go through. But for now, we're just, stirring the pot with the politicians. Yeah, a long burn on this one, but we'll give it a go. Hopefully by the time we get any traction, the federal government might have announced a pot of money to go establish a register for people with Parkinson's or something. I think whatever ideas that you guys are coming up with are fantastic. But the bottom line is you've touched on two really important things. One is stigma associated with Parkinson's, and that is one of the 6 key areas that the National Parkinson's Action Plan wants to address. We've got to break down the stigma associated with Parkinson's. And the second thing is just general awareness. I love, the stats around, maybe 8 out of 10 people know about Parkinson's. If I just go back to all those meetings I had with politicians, more than 12 months ago, however many there were, I think there was about 40. And I break it down into a third. A third actually absolutely knew nothing about Parkinson's, didn't have anyone. Some of them I said, you don't know anybody yet that has it, but you will. The third in the middle said, oh, yeah, I know about Parkinson's because my best mate's grandfather had it. And when I was a kid, I saw the shaking. But the third that know about it really know about it because they've had someone close to them. We've got to change the 2/3. We've got to get those that think they know about it. We've got to educate them so they understand. And the other third to get some really good awareness. And all that we're doing, the state parliamentary friends, what we're doing at a federal level, the National Parkinson's Action Plan, which I will go on to in a minute and talk about the 6 priority areas, it's all about doing better for our community, creating awareness, getting proper models of care going, getting more resources, as in nurses, practitioners, etc., out to rural and regional areas, making it standard within hospitals. You wouldn't have a diabetic miss their insulin injection in a hospital. So why can't our Parkinson's people have their meds on time every time? So the National Parkinson's Action Plan has been developed to bring attention to Parkinson's and hopefully get funding for the service-based organisations, but moreover, get more funding to researchers like Paolo and researchers like Carolyn and Grant and all the others, because there is some pitiful percentage of MRFF money that's going towards movement disorders at the moment. And the incidence of Parkinson's far outweighs anything else. So it's disproportionate, and we've got to change that. And I think the fact that we're called Parkinson's New South Wales, a lot of people just naturally assume that we're a state government body, or we're affiliated and or get huge buckets of money from the state government. That clearly is not the case with our legacy $33,000 a year, which is $35,000 with CPI coming to an end this June. And they've only just reached out in the last 2 weeks to say, oh, let's talk about extending that. And we're going, yes, thank you. It's $33,000. We're not going to say no to that. At least this time they're talking about it being 5 years. So, it's funny how these things work. It just, coming from a business background, it just doesn't make a lot of sense to me, but, it is what it is. And, I think we're making a really good case now to the current state government. And, we'll talk to all sides of the rainbow of political parties, because it affects every single electorate. So every single politician should be invested, because there'll be people in their electorate, along with carers, suffering from the conditions. So, they need to pay attention. So, National Parkinson's Alliance and the Action Plan. National Parkinson's Alliance was a group of about 11 organisation and state-based organisations that came together 2.5 years ago because everything was fractured. The states weren't talking to each other. Half of them had left the Federation. And we started getting on again. So Tasmania, Victoria, New South Wales, state-based organisations, along with Neura, WeHi, Shake It Up, Queensland University, University of Tasmania, and some other interested individuals, there were 10 of us, came together and we started advocating down in Canberra. And 2 years ago, in 2024, we had the summit to end Parkinson's in Canberra. And we did a federal government ask where we were asking for $400,000 to develop a national Parkinson's action plan. So the government actually doubled what we were asking and gave us $800,000, and that money came in over last financial year and this financial year, and a good proportion of you on this call possibly partook in the survey for people with Parkinson's and their carers, along with the workshops and all sorts of things for allied health practitioners. And out of that, here's one I prepared earlier. We've developed the National Parkinson's Action Plan. So, National Parkinson's Action Plan. So this, whilst we did it and did all the legwork with KPMG, this is actually the government's action plan. So we developed it and gave it to them, and they had to review it before they would allow it to go public. And it went public, obviously, in March last year. March, 2 months ago in Canberra, March this year. So the mission of the National Parkinson's Alliance is to be the peak body for Parkinson's in Australia. And we were the entity that led the development of the National Parkinson's Action Plan, and we're the co-convener along for the Federal Parliamentary Friends of Parkinson's Committee. Here are all the organisations who are now members of the NPA. Action plan overview. Okay, so as I said, so many online surveys, so many meetings. It was the voice of thousands, the voice of the nation, and the voice of every participant in our community, whether they are people with the condition, allied health, policymakers, the government. I mean, everybody had the opportunity to have their voice heard. Largest project of its kind in the neurological sector. We know because we've had meetings with Rowan Greenland, who is CEO of MS Australia. He's also the chair of the National Neurological Alliance. They were all a bit peeved that Parkinson's was the condition that got the money first to do the first national action plan. And indeed, internationally, there were also eyes on us. So we will certainly be touting it when we go to World Parkinson's Congress in a few weeks' time. We are actually presenting it at the international conference. So this was the launch, 24th of March at Parliament House. The room was packed. Again, same with the state parliament functions. Both February and last week, the pollies are all saying that, they don't see the room filled so well as when it's a Parkinson's event. Let me put it that way. We have a motivated community, and the pollies go, oh, okay. So a full room is always, they're surprised. Obviously, people who were speaking, the bells were going, so politicians were coming and going, but we do have a photo there of a number of politicians who did make it. That's Senator Askew in the picture with Carolyn Sue. Also to the left of Richard Wiley when Emma Tinkler is speaking, that is Senator Smith and Senator Pocock. They are the three co-chairs of the Federal Parliamentary Friends. So they did manage to be in the room at some point during the event. again, and bottom right there, to my bottom right, that's the board and the original members of the National Parkinson's Alliance. You've got Tasmania, New South Wales, Carolyn Sue, Michelle from Tasmania, Harley Stanton, Dr. Harley Stanton, who was the one who started it all. He was a gentleman with Parkinson's. He was a policy advisor and scientist to the World Health Organization. Jane Alty, clinician and researcher from Tasmania. Grant Dewson from WeHi in Melbourne. Vicky Miller, CEO of Shake It Up. Richard Gordon from QUT in Brisbane, and Emma Collin from Parkinson's in Victoria. That's the crowd who started this mess. So the actual Parkinson's plan overview. Recommendations. Number 1, tackle stigma, improve awareness and ensure access to accurate information. Number 1. Number 2, strengthen prevention strategies to delay onset, improve understanding of risk and disease progression. 3, improve accurate and timely diagnosis and post-diagnostic care. 4, improve clinical care, treatment pathways and coordination of care. 5, build capacity and capability of the healthcare workforce. And 6, improve data and maximise the impact of research. They are the 6 that form the National Parkinson's Action Plan. So what happens now? This great big, body of work's happened. It's been delivered. What's next? Well, National Parkinson's Alliance has gone back to the government and said, great, we've got a plan. We've now got to implement it. Please give us money to help us implement it. So we did a federal submission. We believe that we will not have 1 cent come to us in the budget that's coming down tomorrow. What they have said is strongly encouraged us to put in an application for the chronic care grant that has been announced by the federal government. So we, the NPA, are busily behind the scenes as a unified voice putting together a pitch to get a chunk of money from the chronic care grant to start implementing on the 6 priorities so that you all get better care, you get earlier diagnosis, there is less stigma and more awareness, there's more data, there's more research, more of everything. So that's the next phase. Watch this space. So that's NPAP. How do we work with other organisations? When I stepped into the role of CEO at Parkinson's New South Wales, I announced that Parkinson's New South Wales was open for business with anyone and everyone in our Parkinson's community that was in it for the right reasons and had the Parkinson's community at the forefront. There are unfortunately organisations and people that are only in it for self-serving reasons, but because I have Parkinson's so close to me, which is what drives me so passionately, my mother-in-law passed with it 3.5 years ago, and I have a brother-in-law who is 8 years in his journey. I get it, I've seen it, I understand it in all its glory, and as a condition, as I've said earlier in this conversation, we are so far behind the 8 ball compared to the MSs and the cerebral palsies and the MNDs of this world, and they are all awful conditions as well, but we have way more people, struggling with it every single day, and it's because we have been too quiet for too long. And certainly for the couple of years that I've been in this seat, we've been making noise, and it's going to take time. but we're getting louder. And I love the fact that you all are getting vocal as well and going to meet your local MPs, because we know what drives governments, and it's the individual MPs who want votes to stay in. So if they're motivated by votes. And if you can start being a squeaky wheel in your area and agitate, they want to placate, so they'll start listening. And it's just about building and building and building. So that comes about how do we work with other organisations. So I've spent the last couple of years going out to universities, reaching out to all the other state organisations, talking to anybody who would want to provide supports and services for people with Parkinson's or are researchers in the area, just because we can do so much more together and collaboratively. We can't have individuals going off and just running their own show. So together we can do more. And that's why I'm so excited about going over to World Parkinson's Congress and just seeing what they're doing around the world and the exciting research and collaboration and networks. And, together we can, which is, I think, Victoria's slogan. And in this, together is ours. And NPA's is together for change. So it's about working together and building strong Parkinson's communities, so we don't have to suffer alone, that people are aware that there isn't any stigma, there is appropriate care, appropriate treatments, people get diagnosed quicker. And I know, Stace, the fourth thing that you wanted me to talk about was Parkinson's New South Wales advocacy for New South Wales government funding. All the things I've spoken about already, it's all about advocacy for New South Wales government funding, not only for us, but for nurses and for research and for whatever else is going to make life easier for our community.
Mm.
It's not, my advocacy isn't just about keeping Parkinson's New South Wales doors open, which is, that's one of my remits. I've got to keep the doors open so that you guys have a 1-800 number that you can ring in this state. You have a place to go. You have your support groups still being supported. But it's all of us together. And I think the executive director of the National Parkinson's Alliance, Richard Wiley, says it beautifully, that all boats rise on an incoming tide. We all win when we all work together. So support groups, you guys rock, by the way. Support groups, what you do, the volunteers who organise the support groups, the coming together, the speakers, but also the advocacy. And I know that probably in the past, we probably weren't organised enough to give you what you needed for you to go and do what you need to do locally. But I think that John and the team certainly have the paperwork and the words and the letters for you to go forth and do. And you tell us, please, give us feedback. We are open to listening to what you need and what you would like. And if we can at all do, we will. And on that, Stace, it is a case of please let us know what you are doing, so that we can keep an eye on the media and the socials, etc. But I also make sure that the messaging that you are sharing is appropriate and consistent with our messaging. Yeah, just keep us aware. We're happy for you to go do it, but just keep us in the loop and aware of what you're doing, so we can help. That's all we ask. And we've got another meeting with the parliamentary friends in the next few weeks. We haven't gone down the track of a statewide petition yet, but I tell you what, if we don't get any money in the state budget, it's probably what we'll do is a petition, particularly for the election, and we will, be blasting it out to all the support groups so that you guys can get on board, and we'll probably do one big petition. But always just send letters to your local member, invite them along to the support group. Please let us know if they're coming. Just keep doing all that you do.